Our next guest is Dr. Mark Foster, an orthopedic and spine surgeon who's new to our area. Welcome to the show, Dr. Foster. It's such a pleasure to have you here.
Thank you. It's great to be here.
Good, good. I'd like to begin by learning a little bit more about you and your education and your background. Can you tell me where you went to school and where you did your residency?
Sure. My undergraduate degree was from Clemson, and then attended medical school in Charleston, and following that I was there for another 5 years doing my orthopedic training. Immediately following my residency in Charleston, I participated in a foot and ankle fellowship. That was an additional year of training in Milwaukee for foot and ankle surgery. And then following that, I've done a spine surgery fellowship, another portion of training that was done in Chapel Hill.
Well, tell me about your practice and what it offers and where you're located.
The practice, I'm joint orthopedic specialist, and our main office is in Southport. And though we have offices in Sunset Beach and Leland, and then another office in Supply, I practice with 3 other orthopedists, and we provide orthopedic care across the whole spectrum. And my major contribution to the practice is that for foot and ankle surgery, as well as care of the spine, surgery and non-surgical treatment of the spine.
Yeah, I understand that that's going to be a new specialty for Brunswick Novant Medical Center. You bringing that new specialty of spine surgery. Tell me a little bit about the basic types of spine surgery.
Well, over the years, I've seen spine surgery transition to more minimally invasive. Minimally invasive surgery with smaller incisions, shorter hospital stays, sometimes even outpatient spine surgery is an option.
Wow.
The surgery might include treatment of compression fractures related to osteoporosis or disc herniations with nerve compression, and sometimes surgical treatment for the arthritic spine is an option.
Would there be types of treatment or therapies that would be offered prior to going to spine surgery?
Oh, sure. And generally, we try to arrange the treatment such that it's the least risky treatment first, less invasive, such as medications or physical therapy, sometimes even bracing. And then beyond that, sometimes injection therapy is an option, such as cortisone injections. And if the person's quality of life deteriorates because of their pain or activity limitations, then we can certainly consider surgery as more or less a last resort once if non-surgical care has not been successful.
So you wouldn't automatically take a patient to spine surgery. You would recommend that you go through all these other modalities first and then?
Generally, that's true. If they have a profound weakness about their leg because of nerve compression, sometimes this is actually a conservative thought to go ahead and operate on somebody, because you wouldn't want that nerve to continue to get damaged and lead to permanent weakness. But generally speaking, we start with non-surgical treatment, and then if the patient's condition doesn't respond favorably, can consider surgery beyond that.
I know that many folks have heard that back surgery is difficult. It's, may have had a hard recovery or so on and so forth. But I imagine surgery has evolved to such a point where it's probably less invasive, as you said, minimally invasive now, and things, you have smaller incisions. So it's come a long way. Am I correct?
You are correct in that regard. The surgical treatment I think it's most successful if we can align the patient's goals and expectations so they don't have unrealistic expectations, or I don't present things in an unrealistically achievable goal. So that if we can align expectations with what's actually achievable, surgery is generally more successful. And then making a decision for surgery at the right time. Another consideration would be the patient's overall health. If they have significant lung disease or heart disease, then maybe the risk of surgery are not worth the potential benefits.
Right. Well, are these primarily inpatient procedures that we're talking about, or outpatient procedures, or can they be both?
Well, again, the patient's overall health picture comes into play, as well as their social situation, whether or not they have a caretaker or spouse at home, whether or not they live in a one-story or two-story house. So sometimes they're there for pain control, sometimes for rehab. But I will say that over the years, even fusion surgery for spinal instability, the hospital stay has gone from, say, 5 days to maybe 2 days, and thus with better, more well-designed equipment and the use of X-ray imaging, we've been able to shorten the hospital stay, blood loss, and lower the complication rate.
Well, speaking of complications, are there specific risks that folks should be aware of prior to having spine surgery?
Well, there are risks to any surgical procedure, but in the general picture, those would be, the risk would include infection or bleeding, things like that. But we always administer antibiotics ahead of surgery to try to minimize the chance for infection. But particular to spine surgery, their risk might include nerve injury that might be temporary or permanent. But usually, by way of CAT scans and MRIs done ahead of time, we know the anatomy, we know where to be on the lookout for particular pitfalls or potential setbacks related to a patient's particular procedure.
Okay, that's good information. In addition to the spine, I understand that you do a wide range of orthopedic procedures. Let's touch on some of those.
Right. Well, in my practice presently, I perform foot and ankle surgery, may be related to foot trauma like a fractured heel, or may be related to age-related conditions, or such as bunions or rheumatoid foot deformities, deformities of the toes and foot in rheumatoid patients. And then other potential, other common foot conditions that I would see in my practice would include sports injuries related to tendon tears or ankle sprains, things like that. And also some of that just spills over into orthopedics in general, whether it's a fracture or a sprain.
And these procedures, the spine procedures in particular, will you be doing those at Brunswick-Novant Medical Center?
Yes, I'll be performing those procedures exclusively there. I'm pleased to say that the hospital has invested the time and energy to provide the equipment that's needed to provide the most up-to-date procedures, really.
So it did require some additional equipment, specific equipment for spine surgery?
That's right, a special operating table and the use of an operating microscope and other small equipment, equipment that's designed small for smaller incisions and quicker recovery.
And so you'll begin doing surgery in the next week or so?
That's right. The equipment's arrived, and the hospital staff's been educated about the procedures, both the operative portion of the procedures as well as the post-operative procedures such as physical therapy and nursing care.
Dr. Foster, it's been great having you here. It was great information. But before we go, can you let our viewers know how they can schedule an appointment with you?
Sure. The main number at the office is 457-4789, and I'm in the office Monday through Friday, though most Tuesdays and some of Thursdays I'm in the operating room.
Okay, great. Well, thank you again so much for being here. It's a pleasure. I hope to have you back real soon, and we'll see how things are going for you.
Thanks for the opportunity of being here.
You're welcome.